I'm pleased to introduce our panelists this evening for an illuminating discussion on lifestyle medicine and the importance of sleep and how sleep can impact our health. And so joining us tonight is Dr. Heidi Prather, who is an HSS physiatrist and leads the HSS Lifestyle Medicine Program, and Rebecca Niitzel, who is a registered dietitian here at HSS. So we're so happy to have you both here tonight. Thank you for joining us.
Thanks for having us.
Yeah, and let's dive right in. Dr. Prather, considering the work that you're doing here at HSS, please tell us, what is lifestyle medicine and why is sleep an important pillar?
Right, so lifestyle medicine is it's an evidence-based approach, which means we use the scientific evidence with clinical experience, those two things together. And it's an evidence-based approach to improving or managing, reversing, and preventing chronic lifestyle-related diseases. And what are those? So chronic lifestyle-related diseases are hypertension or high blood pressure, type 2 diabetes, high cholesterol or hyperlipidemia, cardiovascular disease, and obesity. There's also some evidence that's effective with some cancers like breast cancer, prostate cancer, and colorectal cancer. So the lifestyle medicine approach is, how can we improve our lifestyle habits and choices that we make to improve our overall health? And it involves 6 pillars. You mentioned pillars. So there's 6 components to it that are considered to be the pillars of lifestyle medicine. And when I'm approaching patient care with this, we're talking about how do you meld those things together and how they're important. So the 6 pillars are nutrition, and the nutrition piece is really about eat real food, stay away from processed food, less dairy, less meaty, processed meat, less red meat, and kind of eating more towards plants. Another pillar is physical activity. So we're looking for a certain number of cumulative minutes per week that keeps us healthy. Managing stress, so managing any of our mental health component, but particularly stress is a lot of what we focus on. Avoiding risky substances like tobacco and alcohol use or excessive alcohol use. Making sure we have important social connections so that we have support in the lifestyle choices we want that are good for us, and having somebody that you have community around those choices. And then the last pillar we're going to talk about tonight is sleep. And so sleep is super important component of lifestyle medicine because it's interchangeable with all the others. And the reason for that, when we don't have good quality and quantity of sleep, so don't sleep well and feel rested, and quantity meaning number of hours of sleep, it can lead to an increased resting amount of systemic, meaning all over our system, inflammation. And that low kind of systemic inflammation, kind of all over our body type inflammation that affects multiple body parts, is at the root cause of the lifestyle-related chronic diseases. So if we manage our sleep better, we will manage those chronic diseases better, and even working towards prevention and reversal.
Great. So let's talk a little bit about managing sleep. How do we start to begin to think about sleep? And it seems like it would be important to discuss here a normal sleep cycle and ways that it could be impacted.
Yeah, so I always like to talk about, why you need sleep and the importance of the sleep cycle, because then you can figure out, oh, where's my problem? Is it trying to fall asleep? Is it staying asleep? Is it both of those? As I wake up too early in the morning? Everybody's got a different, thing about sleep that may be problematic for us. So if you understand the cycle of sleep, then it can be kind of eye-opening as to what, how you can impact your own sleep itself. So do you want to show the graph of that?
Yeah.
So here's a normal sleep cycle. And so the first stage of sleep is where we're falling asleep. So that's the initiation of sleep. And I know we're going to talk about that, like preparing to fall asleep and getting your body ready for that. And several things have to happen. Our body temperature will change, our core, so our trunk area will cool down, and our extremities will warm up. And that's because of the way our blood flow and circulation happens as we prepare for sleep. The hormone called melatonin that you've heard about, there'll be a spike in that as we're getting ready to sleep, and that helps us initiate sleep. So initiating sleep is really important because that gets us to the next stage of sleep, which is early stage or mid, early to mid stage sleep. And that's when our brainwave activity, there's a slow wave activity, and a lot of our DNA repair and cell repair and tissue repair, all those things happen during that part of the sleep cycle, which is really, really important. It also helps what happens with our cognitive thinking, like our ability to think clearly the next day really happens in kind of that early to mid stage areas of sleep. And that's where, our ability to pull out facts and declarative type activity, cognitive activities the next day is kind of enhanced and repaired. And then we kind of go into the next stages of sleep, which are, you've probably heard of REM, which means rapid eye movement. We kind of go into a deeper sleep at that time. More of our cell tissue repair can happen at that time. And that's where there's some of these other things secreted that actually help suppress our appetite. That's a good thing. We need that. Have an effect on insulin during the day at times, and for people, particularly people with insulin resistance or type 2 diabetes. But on our brain side, it's the side where we actually kind of rejuvenate so we can have creative thoughts the next day. So this is kind of why, kind of going through, and then we go to the kind of the waking cycle, and what happens, melatonin goes down, our cortisol kind of goes up, our temperature in our body shifts back again, our blood pressure kind of rises, and then we go into awakening. If we miss any of those stages of sleep, like you start off okay, miss one or part of one in the middle, and then kind of slip in and then slip out again, you lose the reparative and the regenerative impact of that stage. So usually it's manifested by not feeling rested the next day when you wake up, feeling like you need to nap repetitively, maybe in general feeling kind of foggy and lethargic. Everybody's kind of got a different way they feel it, but definitely you're probably not getting good quality of sleep. Even if you're in bed for 8 hours, you may not be getting good quality of sleep if you're not feeling rested the next morning.
Does the specific stage of the cycle, will it affect the specific outcome? So let's say if you're missing some of the more of the mid-level, right, where physical repair happens, could you still have cognitive, like full cognitive?
Yeah, right. So the early to mid, it's that really kind of factual, like I can pull back a fact, I can remember a name, everything's kind of clear. That's in kind of that first mid area. So after you've fallen asleep, you're in this first slow wave going into mid cycle. And then when you get into that REM sleep, that's where, oh my gosh, if I'm going to be creative and have juices and kind of higher level thinking, that happens kind of in that later stage of sleep. But if you miss one, you miss the benefits of that, and you may not have this continuation from one to another, which is really important.
Can you have the REM, the deep sleep, without the mid sleep?
Not a lot of times people will miss it, or they won't get the amount that they need in that stage. So yeah, you won't necessarily always skip right into the next one. You may stay at some level in between, and then again, you don't get the benefit of it.
And so we are orthopedics, obviously, here at HSS. So I would be remiss to not talk about how sleep impacts our musculoskeletal health. Why is it important to our muscles, our bones, and our joints?
Right. So first of all, we talked about when your sleep is disrupted, whether it's you can't get enough sleep because you can't fall asleep easily, or you're waking multiple times during the night. That leads to that systemic low-level inflammation. And many of our musculoskeletal conditions or orthopedic conditions are rooted in inflammation. So people who report less sleep or sleep quality or less sleep quantity, so like less hours and don't feel rested when you get up in the morning, uniformly report more pain, period. Doesn't matter about what your pain's from, period. You report more pain. And you would think, well, okay, so I should just treat my pain so my sleep will get better. That's kind of a natural thing. And some studies specifically around osteoarthritis show that if you just give people pain meds, their sleep cycle doesn't improve. But if you improve their sleep cycle, the report of pain goes down. So for me, talking about sleep is really important with anybody I'm seeing. on to get them in tune with your sleep is contributing to the level of pain and the intensity that you're reporting. In addition to working on your musculoskeletal condition, we need to talk about how to have better restorative sleep.
Right, because ultimately it seems like they're really interrelated,
Right.
and that a lot of people aren't sleeping well because of pain. And I think we'll circle back to pain in a little bit. So we understand a little bit more how sleep can impact our musculoskeletal health. And Rebecca, I'm particularly interested how sleep can impact our nutrition in terms of our physical health, not only what we eat, but maybe how we process food as well.
Yeah, definitely. That's a really great question. So sleep is linked to our appetite, right? So and that a lack of sleep can lead to overeating. So this is due to a number of reasons, including hormones, ghrelin and leptin, which both influence appetite and intake. So one makes your appetite go up and one kind of suppresses it, right? And so sleep, just like Dr. Prather was talking about, helps us balance all of our hormones, keeps us in homeostasis. But when we have this lack of sleep, we can have an imbalance in our hormones. And so specifically when we're talking about nutrition and appetite, you have that imbalance in leptin and ghrelin. And so this leads to more hunger, less feelings of fullness compared to people who get the 7 to 9 hours of sleep. And it also impacts how your body processes insulin, which is the hormone that regulates your blood sugar. Something else that a lack of sleep can do is that it leads to low diet variety. So people who sleep less than 7 hours tend to eat less protein, less fiber, choose more calorically dense foods, and overall get less variety in their diet. And when you think about it, this makes sense, right? Like, you're really tired. It's just easier to grab, the pizza or the fast food or something that's just quick, calorically dense, as opposed to like cooking a whole balanced meal with all of your macros.
I can totally relate to that. Last night I was exhausted and mac and cheese was much more available than roasting broccoli.
Yeah,
so.
You don't make good decisions when you're tired.
No, luckily I got some good sleep last night though. And that's fascinating. I didn't realize that the diversity in your diet would change just because of the amount that you're sleeping.
There's a study out there that shows when you have lack of sleep, the next day you grab 300 extra calories per day, and they tend to be towards carbohydrates and processed carbohydrates, probably because it's our comfort thing for a lot of us. So 300 calories can be a lot,
Yeah. Quick energy from the carbs. Yeah. And then, that we'll get into it a little bit more later, but then that can obviously lead to obesity and diabetes, cardiovascular disease. And so the lack of sleep is linked to those types of diseases.
Wow. That's really great to keep in mind. One of the and just another benefit of good sleep would be making healthy food decisions and also being able to stay in terms of recommended caloric intake. So I think we're getting to understand the importance of sleep and the impacts of sleep. How much should we get? How do we know? And is it really a quantity thing or a quality? Dr. Prather, help us out.
Yeah. So honestly, they don't know how many hours of sleep we're really supposed to have, probably because it's variable based on person, our DNA makeup, our phenotype makeup, what family and environmental things. No one really knows, but the goal is to get somewhere between 7 and 8 hours of sleep. The average American gets under that, just under that. So the goal is quantity wise, is to try to hit the 7 to 8 hour mark. The quality thing is, again, is under recognizing how many times do you wake up at night? Do you feel rested the next morning, maybe even if you didn't wake up at night? If you're feeling like you need to nap in the middle of the day, or don't feel it takes a while to get your engine going first thing in the morning, longer than you would expect, those are all probably good signs that you may not be having good sleep quality. If someone who's sleeping near you, recognizing you're snoring a lot of the night too, that may be kind of a warning sign for something called sleep apnea or obstructive sleep apnea. Sometimes the initials OSA are used. And that's something that too is linked to chronic diseases, and you'd want to make sure that was checked out if that was a repetitive problem.
What about those folks who need only 5 hours? Can that actually be a thing?
Yeah, so that's the thing about the culture of sleep, right? I'm a recovering bad sleeper myself. It was real common in the heyday of a lot of my administrative responsibilities that my team would get an email from me at 1 a.m. I was raising small children, and what everybody has to do in life, those kinds of things. Yeah. But we now know that it's linked to many of these chronic diseases. It needs to be something of importance. It's a cultural thing we need to break, right? And what we didn't talk about specifically earlier, but definitely the cognitive piece, and there's more and more information coming out about early dementia or dementia and Alzheimer's linked to poor sleep habits over a long period of time. So yeah, I think our culture in the past was, you're a miracle person, you don't need any sleep, blah, blah, but everybody needs it. Your body needs it. And your mentality may be that I can push through, but your body will keep the score over time with regards to your general health.
Great. So we've set the stage, and this webinar is titled Strategies for Better Sleep. So I want to get into it. What are some of the lifestyle interventions for sleep? How can we start to get better sleep?
Yeah, well, the first thing, that people are probably most familiar with is sleep, what they call sleep hygiene, which really is talking about how do you initiate sleep and fall asleep more easily. So if you recognize that's your problem, and once I'm asleep, I always seem to be okay, but I can be in bed for 2 hours at night before I fall asleep. So how do we get ourselves prepared for sleep? So Rebecca will talk about, the nutritional piece, but the real obvious things are getting your body ready for sleep. Darkness. We know darkness increases our melatonin spike. That's the thing that helps initiate sleep. So an hour or so before bed, getting into a routine is really important. And the light sources around you are an important part of this. So sitting in a bright room with like games on TV that blaring at you with lots of lights are going to keep your brain stimulated and not allow that normal habitual part of melatonin release to get ready. So lights are really important. The temperature of the room. We talked about how the core or the trunk part of the body's got to be able to cool down and the extremities need to get warm. So the room temperature is really important. Sleeping in a really hot room can be really hard. If you're somebody though whose extremities are cold, you may be somebody who needs socks all the time because your feet need to be warm and your trunk needs to be cool in order for that stage of sleep to happen. I'd say those are some of the biggies. And then if you're in bed and then I still have you're still planning meals for next week, what's the grocery store list, what's on the plate for tomorrow, we call that ruminating, where your brain's going. Other habits you can get into are either reading without a backlight on it, listening to certain types of music, warm tea or warm water drinking, again, no caffeine. And then there's also apps out there that can be real helpful that kind of work you through patterns and you can find a pattern that works for you. So any of those things are things I have people start with.
Apps as in like a pattern for a routine or like a relaxation?
Yeah. One of my favorite ones actually right now is called CBT-I Coach. And so we will talk a little bit later too about all the different types of things you can do to help with sleep beyond just these habits. And it kind of takes and record the habits with the cognitive behavioral therapy. So you can get your mind to stop going 100 miles an hour. We're pretty stimulated, more stimulated than ever because we're sitting in front of so many screens all day. But I find those to be helpful for folks.
Great. And Rebecca, what about dietary interventions for improved sleep?
Definitely. So there's a few specific things that I'll go through, but first I'm going to give the really boring dietitian answer of eat healthy, eat a balanced diet, eat more fruits and vegetables, whole grains, get your 25 to 30 grams of fiber, less processed meats, less sodium, less than 2,300 milligrams. I know it's annoying to hear, but that is a tool in your toolbox to make your sleep that much better. So that's the general recommendation. Do your best to eat a healthy diet, right? But more specifically, caffeine intake is number one. So while caffeine, yes, it makes you feel more awake if you're sleep deprived, it doesn't, erase the unwanted side effects of sleep deprivation. And caffeine intake before bed, of course, can affect your sleep quality, though the amount of caffeine that impacts you specifically does depend on your genetic makeup and how often you consume caffeine. So in general, try to stop consuming caffeine 6 to 8 hours, ideally, if you can, before bedtime. But again, keep in mind, everyone's tolerance is different. So number 2, late night snacking, trying to avoid a large meal or a large snack before bedtime, because this can lead to reflux and indigestion, and that can just cause you to be uncomfortable when you're sleeping. And so especially staying away from spicy foods, high fat foods. So you want to avoid those large meals and heavy snacks 2 to 4 hours before you go to bed. It's totally okay if you're someone who wakes up like starving in the morning. You can have like a light snack before you go to bed, some crackers, some yogurt, something like that, but nothing like too heavy that you're going to be digesting all night. Number 3, this kind of ties back to the general recommendations that we were making, right? So obesity. Obesity is associated with obstructive sleep apnea, OSA, as Dr. Prather was talking about, which of course can cause poor quality of sleep. And so maintaining a healthy weight through diet and exercise can also help. Something else that we would recommend is to avoid alcohol. Even though you feel like alcohol can help you fall asleep, it does decrease the quality of your sleep and the duration of your sleep.
Great. So much easier said than done, huh?
So true.
These are a lot. And I think that what starts to happen is that our lives are so extremely busy, and it seems this is obviously cyclical. So we're tired, so we reach for the caffeine again, which is going to make us not sleep as well. So are small changes going to help? Rebecca, Dr. Prather, please feel free to jump in here. Is this something that we need a complete overhaul of our sleep hygiene, from one night to the next, or implementing small changes at a time we might see some improvements?
Yeah, I think when it comes to behavior change, small digestible changes are always easier. So you want to start with 1 or 2 easy things that you can achieve. Give yourself some time to achieve those. Maybe you choose, okay, I'm not going to have my soda at 4 p.m. and I'm going to turn off the lights, an hour before I go to bed. 2 simple things to focus on at first, and then move on from there. I don't think, for sleep or for diet, which is, where I'm coming from, a total overhaul generally doesn't work for people. That can be kind of hard, even for me.
Yeah, so I completely agree. And there's something called a SMART goal. So you're trying to find a goal that's low-hanging fruit. Give yourself a break. Figure out what's the easiest thing to change. That's the thing you commit to. For some people, it's like you commit to, turning off the lights earlier. I commit to not drinking caffeine after 4 o'clock because I'm drinking it up to 9 o'clock, kind of ease your way into it. When you make behavior changes, though, you actually start to notice you physically feel better. It's so much easier to stick with them. And so trying to accomplish everything all at once can just be a total disaster. And then you actually end up, not changing anything. The other thing we should mention is that the things we're talking about tonight are all the things that you can change. And people do have, sleep disorders that go beyond even obstructive sleep apnea that may be manifesting like restless leg syndrome or rapid movements in your legs. And that can be linked to a neurological disorder. There's people that have just true out insomnia, where they can't quiet their brain at all, and they may need other types of interventions, and a true sleep study that maps out that cycle that we went through can be really important. Narcolepsy you may have heard of, where people just suddenly fall asleep and their cycle's kind of erratic. So there's a number of those, but in general, just trying something small to begin with to improve your hygiene is going to help your health in general. But we need to advocate to make sure people may need to seek out the help of a sleep specialist if some of the things aren't helping. And we didn't talk probably enough. I was trying to give external things, but ruminating is a real big one, right? You're laying in bed. I got laundry to do. I've got the grocery list. I've got pressure at work. I've got responsibility of the kid. Yes. I mean, it just goes and goes and goes. And what I tell folks is, and I struggle with that, myself, and for a while, certain things will work. And then just give yourself a break and try something. So we talked about an app that works for some people. Music can be that. Meditation, or mindfulness stuff where you kind of try to get your head clear. Deep breathing can really help with that. And there's certain types of, classes you can go to, whether it's a yoga class that kind of focuses on breathing and finding your breath. But experiment with some things, and that can be actually kind of fun or joyful. And we know that that's, a part of getting our mind calm so we can actually, fall asleep. So I can stay asleep.
Yeah, thank you for mentioning those things. So I'm actually excited to share with the group here is that after we'll share a few videos and meditations that we produced here at HSS, even by yours truly. There's a guided progressive muscle relaxation, which is shown to be really helpful in preparing for sleep and getting to sleep. And when we're talking about bite-sized things to give a try, these videos are 6 to 10 minutes. So they're relatively short. And those are some great meditation and relaxation strategies that you can try. We also have some meditation and mindfulness programs here at HSS. And if you're interested in learning more, you can reply to the email as well, and we'll send out some information about that. But thank you for bringing those up, because I find that those are the things that are keeping me up at night. I got the caffeine down, I don't eat past a certain time, but it really is the thoughts and the ruminating that not only prevent me from staying asleep or prevent me from falling asleep, but then also seem to wake me up, surprisingly. I don't know quite how that works, but we didn't talk about yet supplements to support sleep. And I know I did see some questions about melatonin. And so, Rebecca, is there any research that points to the efficacy of certain supplements to help sleep?
Yeah, so it's definitely tough to study this. So melatonin specifically is probably the most studied one for sleep, and a lot of people do take it. I do just want to say in general, I'm not recommending anything for anyone. I'm not going to talk about specific dosages just because I'm not a doctor. But melatonin does quicken your time to fall asleep, and it can increase your sleep duration and quality. And that's because it is, a hormone in our brain that is linked to our circadian rhythm. And it has been shown to be effective for shift workers and for jet lag, but it can cause drowsiness. Some other supplements are magnesium. So that one isn't as studied as much, but it can help improve sleep quality by changing the amount of some neurotransmitters that have like a calming effect in your brain. But it's just important to be careful with magnesium because it can cause some GI distress. I believe there's a gummy supplement that's literally called Calm, because again, the thought is that magnesium produces calmness, and then hopefully those ruminations don't come in and you can more easily fall asleep. I do think, though, if you look at your diet and you know that you're not eating a good variety, maybe magnesium is lacking in it. And so it might be a good idea to start supplementing just through food sources. So pumpkin seeds, chia seeds, peanuts, that would be a great place to start. And then there are different types of teas that are have been shown to help with sleep. So chamomile, lavender, passion flower, valerian root, they all have flavonoids that might help with your sleep. I think for the most part with teas, something that you can do is kind of like habit stack. So you create this routine, kind of what we've been talking about. So you make your tea that's supposed to be good for your sleep. And then you either meditate while you're drinking it, or you journal, your gratitude for the day or something like that. And then there's other supplements that are not as well studied. I do think hopefully in the future, there's more studies on cannabis and CBD. I don't know a lot about that now, but there seems to be some promising research in terms of that. So hopefully one day we know a little more.
Great, thank you for sharing. And there was a specific question about taking melatonin with high blood pressure. So are there any specific considerations for melatonin use?
I don't know that there's a specific contraindication with any of the high blood pressure medications, type 2 diabetes medications, non-steroidals. There's not really a real known contraindication, like for sure avoid it. I think, to reaffirm what Rebecca said is that, some people, melatonin is the thing. It really helps them. They take it on a regular basis. Their cycle gets regulated, and they can kind of drop it. And then other people really can get kind of like almost like a hangover with it. They feel kind of sluggish the next day, don't feel so clear of thought, feel like they have a hard time waking up. And so it's kind of a little bit of trial and error. The other thing about anything that supplements is just remember that our government is not standardizing all of them on companies. So when, Rebecca and I are always going to hesitate what we say about that, because it's not like a medication where it's regulated the exact amount that's in it that the company produces that's given to you. Supplements are not regulated in that way. And so you've really got to read the label of what their recommended dose is. But one brand may feel different to you than another. And again, it's because of lack of regulation. Just be aware of that.
Yeah, that's really helpful. And I think along the same lines, Dr. Prather, if you don't mind touching on how other medications can impact our sleep, specifically those that have been known to help or have been used to help promote sleep.
Right. So there's medicines that are actually called sleep aids, and they're really intended for short-term use around like in a specific event, like a surgical event or a really catastrophic time, a mental health time in life, like around, loss of a loved one or something really tragic like that. But they were not necessarily intended for long-term use. And the reason why they're not intended for long-term use is they may help you be sleepy and feel relaxed, but they don't allow you to go through all the stages of sleep. So these things out there that are considered sleep aids, a lot of times actually can impede your quality of sleep long-term, and you shouldn't be using them long-term. And that's not necessarily how they're always prescribed, and I see people kind of begin to actually need them because they don't have other means of falling asleep. The other thing too, because we are talking about, pain conditions that are related to musculoskeletal health, is pain medicines really mess up your sleep cycle. Now you think, I'll take a Vicodin at night so that I can fall asleep. It can make you sleepy, but it will not allow you to engage in all the areas of sleep, the stages of sleep we talked about, and can actually disrupt your sleep cycle. So again, going towards other medicines that are known to help. If you're somebody who actually needs a medication to help with sleep long-term, the most studied group probably still is a group of antidepressants. And what they do is they help us reabsorb neurotransmitters at night that normally our body does when we have a normal sleep cycle. They happen to also be related to pain. So sometimes we get, dual benefit out of that. But again, it's kind of a misnomer in the language there of the medications that can really help your sleep cycle aren't really in the sleep aid category, so to speak, with the exception of ones that are given for really high level disorders like the narcolepsy and the insomnia, and those are ones that are very specific and should be prescribed by a sleep specialist.
Does it include the sleep aids include like things over the counter medications too?
It can. Like, so, antihistamines, sometimes you'll see an antihistamine paired with Tylenol or acetaminophen. And again, it can make you sleepy, definitely makes me sleepy, but I may not get through the stages of sleep after I've fallen asleep, and you may have lots of awakenings or not fully go into the stage of sleep and get to deep sleep.
Great, thank you for clarifying. We have a question about sleep aid as well in the chat. Can you take a sleeping aid if you're using a CPAP machine?
Yeah, I would definitely talk with your physician about it, because you probably had a specific sleep study, and there may be certain meds they would want you to avoid based on what your sleep study showed, which part of the cycle of sleep you didn't hit right or didn't, progress to. So I think I'd probably, if you do have a CPAP machine, I would be consulting the physician or healthcare provider who helped get that initiated.
Great, thank you. I'm going to turn to some other questions in the chat as well, because they're really great. So if you are in the audience and do have any questions, please do feel free to put them in the Q&A. While we're not too far off from the discussion on supplements, Rebecca, what's the recommended time frame in which you should take magnesium to help with sleep? An hour before, 2 hours before, 30 minutes?
I don't know if there's a specific recommendation for magnesium. I would probably an hour to half an hour, but I'm actually not positive about that.
Okay. And then along the same lines, someone wrote, I take melatonin before bed, but when I keep getting up every 2 to 3 hours, can I continue to take melatonin dissolvable tabs throughout the night? Dr. Prather, I'm going to defer to you on this one.
Yeah, I mean, it seems like that would be logical, but probably, we talked about how the melatonin level needs to go up, and then it needs to stay up, right? And then it needs to slowly, gradually come down so that your cortisol spike wakes you up. So if you continue to bombard your system throughout the night with it, you're going to probably disrupt that deep stage of sleep. I don't know there's a perfect answer for you, but I think I wouldn't take it beyond the second round. If you're like, go to bed and it's 2 hours later and you're like, okay, maybe it was a dose thing. So the next night, maybe you, instead of if you're taking a 3 milligram tablet, you try the 6 milligram. I'd probably I'd stay with the same brand, because your system's going to react to it similarly versus a different brand. And then you may change the brand too. When you're looking at brands, you want to look at the ingredients and make sure you see it's just what the thing is you think you're taking, and not things you don't know what they are. You don't want to take those. So oftentimes it's fillers or other types of things. So if you can't pronounce it and you don't know what it is, don't take it.
Good advice for sleep aids.
And simple.
What can you do to help with cognitive issues that lack of restorative sleep causes, maybe other than just sleep more?
Yeah. So again, if you're finding you're foggy and it's a repetitive problem, and you've tried sleep hygiene, and you've tried some of these aids, and you've gone at it with the music and the apps and the relaxation, I would definitely get a true sleep evaluation from a sleep specialist, and your primary care provider can refer you to one. Pretty much every major hospital system has a service for that, because it's going to need to be nitpicked apart to figure out what parts of sleep you're missing, and then designs the treatment plan.
Great. This is my kind of question. Would a 6 to 8 ounce cup of hot chocolate before bed be bad because chocolate has caffeine and sugar? Rebecca, what do you think?
It really doesn't have that much caffeine in it. The sugar isn't ideal, but if you find that that's like the comforting thing that helps you get to sleep, I just hope that you're not lactose intolerant, because that would not be great for your sleep quality for sure. But it's not the worst thing that you could choose.
So maybe a chocolate fix could be cocoa with almond milk and agave.
Maybe that's
Is that good? There we go. So we got rid of the sugar, but it's still sweet. We got.
I don't want to take things away from people, but
yeah. That lean into that maybe. That if
Yeah.
If that's your routine and it's good, but the heat, right? The heat can sometimes really help initiate that slow down piece. So cocoa, we don't think has much, of the caffeine in it. Going away from a dairy product. So try almond milk or soy or oat, whatever one you like. And then agave or monk fruit juice to me tastes a little mapley with cocoa. But
yeah, that's a tough one. But whatever
I would
you
do
like.
the agave. I would do the agave, and that's again more of a natural thing that your body doesn't necessarily put a huge insulin spike, cortisol or insulin spike with. So something like that.
A bit less of it than maybe sugar.
And then invite us over and see if tell us you got the recipe right.
Definitely.
Tell us if that works or not. Yeah.
We've talked a lot about falling asleep initially. What factors contribute to not being able to stay asleep?
Yeah, so not being able to stay asleep means you're skipping through some of the stages. And so anything that can be disruptive in kind of your cycle or your habits ahead of time. So that can be medications we just talked about. That can be alcohol, sodium quick right before bed can really disrupt your ability to stay asleep. Things that can help promote you staying asleep at night. This sounds so crazy. Daytime light. Where it's February and I'm talking about getting light in the afternoon, which is a hard thing to do in the Northeast. But studies have shown even between right now, it'd probably be between 1 and 3 in the afternoon would be ideal. Even you get 10 to 15 minutes of a little bit of a little walk or a little sit outside on a bench and you get that natural sunlight. It helps your melatonin shut down and it helps initiate that sleep piece right after you fall asleep. Sounds crazy, but it works. So in my calendar, at my work, my medical secretary knows, okay, she's getting tea at about 1 o'clock, but really what she's doing is she's going outside because she's got to see the sunlight. She's being caged for 6 hours now. We got to let her out. But I've made it a habit of that. And man, difference that made for me.
15 minutes?
15 minutes, man, outside, get a little sunlight,
Wow.
real sun. Yeah, and you got to, work at it.
Not through the window.
Not through the window. Get outside.
Okay. All right. This I have to add into my day. A few people asking if you could repeat the name of the app, Dr. Prather.
Oh, yes. I'm sorry. So I'm going to look at it so that I say it right. So it's C like cow, B like baby, T like Tom, dash, I like igloo, coach, like your football coach. And it's a pale light blue background and it's got a moon that's white on it. It's free. It was created by the Veterans Association. So it asks you, do you acknowledge the veterans did this? But there's none of your data is collected anywhere. It's all for you to use and it's free. But it takes into account the habit part, which, you can get from a talk like this. But then it also goes into a piece asking you kind of questions that kind of get to why you might be ruminating. If there's stress in your life, if there's, the neighbor upstairs driving you crazy, whatever that is, right? It kind of has these kind of cueing questions, which kind of gives you some insight. And it's kind of almost like a little bit of, I don't want to say self, but it's a prompt for something called cognitive behavioral therapy, which is kind of that next step after you've taken all these measures to improve your sleep. If it's not working, cognitive behavioral therapy is one of the things that can help with that. And sleep specialists administered, we've got a physical therapist that's developed a program like that I work with patients who have chronic pain and sleep problems. So I just found the app. The American College of Lifestyle Medicine Healthcare Systems is studying it. So I feel comfortable saying, there's multiple people promoting this for their patients right now. So I feel comfortable suggesting that one in particular.
Great. Thank you. And I put the name of the app in the
You
chat.
got it. Thank you.
Awesome.
That's it.
A couple more great questions. A few folks did ask about sleep and fibromyalgia. Dr. Prather, is that something you can touch on?
Yeah, that's a great question. So first of all, fibromyalgia is, a chronic condition where people have muscle pain and they tend to have other problems that go along with it, which is GI problems, which again is related to our gut health and how that affects our brain, right? And it's thought to have a neuro base to it. Like there's the nervous system itself is kind of firing erratically and doesn't know how to shut down. And therefore you can have pain in lots of different places. So people with fibromyalgia specifically, sleep is one of the important things they need to work on. And again, we talked about, because if we can get that sleep cycle regulated, that means that autonomic function in our nervous system, instead of being here all the time, gets to here. When it gets to here, we have less pain, we have better cognition. So it's just the same as everything else we talked about as far as how to get there. But the importance of it, I think, is even more so in people with either chronic muscle pain, even if you've not been diagnosed with fibromyalgia, but particularly fibromyalgia itself, and the gut health associated with that is making sure you have good gut health and is really, really important. One of the neurotransmitters that's reabsorbed in our brain called serotonin, we know it's missing in folks with fibromyalgia, and serotonin is this neurotransmitter that makes us feel rested and our muscles feel good the next day. So again, if you don't go through the stages of sleep, that's not reabsorbed, and you go, ooh, gosh, why do I hurt? Or why do I feel like I ran a marathon? I was just in bed for 8 hours. It's because of that dysregulation.
Fascinating. This will be the last question, and I'd like to address just a couple. There are a few people that are asking about waking up in the middle of the night for various reasons. Hot flashes, menopause, pain. What is the best, how should we approach waking up in the middle of the night and getting back to sleep? What's kind of a strategy there?
Yeah. So yeah, different causes maybe for different reasons. Menopause is a common one. Again, some people find certain supplements really help, making sure vitamins, and that helps with the staying asleep, but which would be different than if you're dreaming or pain. Pain's a different thing. So let's take the pain one. So pain, when you wake up at night and you have pain, reposition, start the initiation of the good habit over again. If making sure no light stimulus, if you need to turn the low level music back on, or the meditation, the deep breathing, and just get yourself back into it. But positioning can be really, really key. Do you have pillows that help offload areas that might be painful? Like you lay on your right hip and your hip hurts. Do you stuff a pillow between your back, your hip? Do you have pillows between your knees? You can become what we call a pillow farm in your bed, but those types of things. So be prepared for that. Heat or ice in the middle of the night might be something you keep at your bedside as well. If it's the menopausal thing, again, starting what you started before with the initiation of sleep, the temperature thing is just so key with that, right? Because your thermostat's just, it's lost itself. It doesn't know what's going on. Again, nutrition, good nutrition seems to have some link with menopause, but there's so many factors into why certain people feel a certain way. So I think my bottom line is, why are you having it? Temperature is important, and then reinitiating the things that helped you go to sleep before, being prepared for that.
Right. So if it's happening a lot, really taking a good look at what's going on, employing some of those strategies, and if they don't work, then reaching out for some additional help. We are at time for this evening, and I'm really excited about all of the information that I learned this evening, and especially because we see how interrelated sleep is to our mood, our physical health, our mental health, our relationships even. And so thank you both so much for sharing all of this information tonight. If you are joining us live, we'd love to hear how you liked this webinar. So please do share your thoughts about the program by completing a short survey, which is in the chat. I've placed that link in the chat. You'll also be redirected at the end of the program. And at HSS, the world's best musculoskeletal specialists, we really do work together to provide the best care for you. So if you'd like, we can assist with any medical questions that you might have, and scheduling and following up, learning more about our lifestyle medicine program, for example. And you can contact us at 917-260-31 888-888-8811. That number is also in the chat as well. And thank you both again so much for joining us. And we look forward to seeing you back here next time. Have a great night, everybody.